Hey girl, welcome back to the Joy Journey. Thank you so much for being here today. Here we talk about all things infertility, faith, motherhood, getting you from a mindset of being defeated or doubtful to a mindset of being very fruitful and hopeful that you will get towards your baby. I really appreciate you spending your time with me here today. So I know that March has officially ended and we're on April 1st today, and we celebrated endometriosis and becoming more knowledgeable, spreading more knowledge about endometriosis throughout the month of March. However, this is something that people with endometriosis experience every single day, and I'm one of those people. So even though we're a day shy, I would still want to discuss with you today my endometriosis story. I want to talk about the complications, the diagnosis, and all of the things, the treatment related to this diagnosis. Also, if you don't know that you have endometriosis, but you're having symptoms similar to those that I'm going to be discussing, it will be kind of a push for you to go ahead and talk to your gynecologist or physician about the possibility of this being a diagnosis that you have. So thank you so much for being here. Let's get into the topic. Okay, so I'm going to start at the beginning, you guys. I was actually never a person that had any issues with painful periods, heavy periods, anything like that once I started having my periods as a teenager. So when I noticed a change, it was very, very obvious to me that something was wrong. And I honestly did not notice a change in my cycles until I turned 24, between 25 and 26 years old is when I started to see a difference. By then, I had been dating my husband, then boyfriend, for about 9 to 10 years. I noticed that with intercourse, there was issues with pain, like excruciating pain with positions that allowed you to penetrate more deeply. That was something that I had not experienced before, so that was new for me. But in addition to that, after experiencing that, I started having painful periods, which I had never had before either. And these periods, you guys, were so painful that it would literally stop me in my tracks, bring me to my knees. I mean, it would feel like something was pulling from the inside downwards, out through my pelvis. It was that bad of pain during the periods. Also, the other thing that I would notice is constipation. Constipation was not just a regular, constipation. It would hurt so badly to actually put any type of pressure or force down there to defecate, that I would have to sit on the toilet for a long period of time in order to just let the bowel pass without me having to put force, because the force, it was too painful to bear. I mean, it was something that you couldn't really push through. So those three symptoms alone for me, which was the pain with deep penetrative intercourse, the periods that were extremely excruciatingly painful, and then the constipation that came along with the pain with defecation, were the three things that led me to question what in the world, girl, was going on. Okay, so I was a nurse at the time. I became a nurse in 2003. So at the time, I was already in diagnose mode, trying to figure out what in the world was going on with my body. So I started researching, looking things up, paying attention to my body a little bit more, seeing what things preceded the painful events or inflammation so that I could then bring it to my OBGYN. So by the time I presented this to my OBGYN, I actually gave her the diagnosis. I mean, that was at the top of the list for my differential. So she went about working me up for this diagnosis to rule it in or rule it out. I ended up having an ultrasound, and on ultrasound, there were small cysts within there, which, you can have cysts from anything, not necessarily endometriosis. So that's not a telltale sign, but at least a symptom. So she did see cysts that had developed within my uterus, like small cysts here and there. She then did a bimanual exam, which is when you have your pap smear and the doctor goes in, puts the hand in there, and they're feeling around just to make sure that everything is moving around the way it's supposed to be, that there's no adhesions that are keeping things stagnated inside your body. So we did that, and with that exam, it wasn't anything obvious at the time that there was endometriosis. So there was still some motility inside of the pelvis. But she also did a pap smear. She did some blood work. She did all kinds of other things just to kind of rule out obvious things from there. But Based on the cyst that she found, based on the fact that I had the nursing background, and based on the fact that I was having 3 of the top symptoms that most people experience with endometriosis, she decided to go ahead and schedule me for a laparoscopic procedure right away. Let me back up. Okay, so for those that don't know what in the world endometriosis is, it's basically tissue that is very similar to the tissue that lines our endometrium, okay? But with those that have endometriosis, tissue that's similar to that tissue in the lining have found their way to different areas within your reproductive system, around your reproductive system. Sometimes people even find these spots as far up as the lungs, you guys. It can be on your bladder, it could be on your bowel, it can be just about anywhere in this cavity here. So that is what endometriosis is. So a laparoscopic procedure is the only way to truly diagnose, because you've got to put your eyes on this disease in order to figure out if it is really what it is. So a laparoscopic procedure gives the doctor the ability to make some incisions, and they make anywhere between 2 and 4 incisions depending on what they have to do, right around the belly button, maybe in the groin area here and there. They make these incisions so that they can go in with a little camera and a light, and they'll actually visualize what's going on. If they determine that there are endometriosis cysts, spots, adhesions, lesions, chocolate cysts, spot, well, however you want to say, whatever it is that they view, they make a decision at that time if they can actually go in and cauterize those areas. And basically what it is basically burning the little spots, which actually deactivates kind of like the top layer, maybe a little bit lower than the top layer of those spots, so that it does not get inflamed and it doesn't cause you pain and issues anymore. It kind of deadens the spots that they see. Now, if there are cysts or areas that have gotten embedded into the tissue pretty deeply, here's our nifty picture here. If it's gotten deep, 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 you see how these are kind of thick and chunky? These are chocolate cysts. Those little spots have to be removed or incised or taken out. And so the doctor will make a decision at that point if that's something that they can do at that point, or they may, do what they can, come out and go back in later. Your doctor will also make a decision if you're a good candidate for robotics, and robotics is guided by a robot basically, and they can actually see more, do more, be a little bit more aggressive with the technique, but you have to find a specialist that's very seasoned in robotics. But it's also another form of laparoscopic procedure to take care of those adhesions or whatever you have in there. Some people have adhesions so badly that they have to have doctors from multiple systems, like a GI specialist or a nephrologist, to come in to the surgery if, let's say, the cysts and adhesions and things have just confuse and jumble things up so badly that we have some stagnation, things that won't move, or we have some issues with it embedding too deeply into the tissues of your kidneys or your ureter or your bowel or something like that. They may have to have different specialists come in and assist with the procedure to get it out. But that's rare. That's when you're like stage 3 or stage 4, the worst case scenarios of endometriosis. Okay, so my complications. What in the world did she find in there? Well, sure enough, it was endometriosis. It was stage 3, and she keeps saying stage 3, stage 4, as if it was very close to stage 4 of endometriosis that she found. I did have chocolate cysts, I had adhesions, I had cysts that had adhered to the bowel, and that's why I was having so much pain and adhesions, because it was kind of stretching and pulling the bowel in different places. So that's why I was having so much pain with defecation and so much constipation, because things were just kind of being pulled and stretched, and things couldn't flow easily through my colon. So I had that issue, and then I also had adhesion spots and all that within the reproductive system, so on the ovaries and those types of things. So I did have a pretty bad case, so thank God that I did go in, have it checked out, get it diagnosed, and went forward with that treatment. When I made my follow-up appointment, she discussed with me that the best thing for me to do would be to get pregnant right away, have children, so forth and so on. Now, at this time, I was not married, okay? So that was not on my radar. I was not ready to get married. I was not ready to have children at that point. So what we decided to do was try to suppress the periods for as long as possible so that it would decrease the chances of inflammation, of tissue releasing. Endometriosis does not go away completely. There's no cure for endometriosis. There are things that will cause it to be in quote unquote remission or dormant where you won't feel symptoms, but there's technically no cure for endometriosis. So we were trying to minimize the rate in which the scarring and those things would return. And we decided to go the route of suppressing the cycles with birth control. The birth control that we chose to use at the time was the NuvaRing. It was easiest, it was more hands-off. I was doing so much and so busy, schooling, all these things during that time that I didn't want to be dependent upon a pill that I had to take every day. So we did the NuvaRing, and instead of taking the NuvaRing out, if you're familiar with the NuvaRing, you put it in for 3 weeks, you take it out a week to have a cycle. But we don't want that cycle to come every month. So we did that, and honestly, you guys, I did that for 6 years. 6 years I was on the NuvaRing and pretty much continuous NuvaRing to suppress it. Now, the good thing about this, I did not have the reoccurrence of pain, but just because you don't have the reoccurrence of pain does not mean the endometriosis is gone. I want to make a quick note for you. Endometriosis is finicky, whereas you may have stage 3 or 4 and not as much pain or minimal pain, or you may have stages 1 and 2 and be in a whole lot of pain. So the stage of the endometriosis does not always correlate with how it presents. So just because you don't feel pain, you can't assume that it's gone. But anyhow, so I just wanted to say that, I just wanted to add that caveat so that you guys were aware of that. As for treatment, what was also very helpful for me was making small changes in my diet and lifestyle. And in my 20s, I made small changes. Seriously, y'all, small changes, nothing drastic. But when I got married and we started trying, and then we later found out, you guys know that I also had low ovarian reserve, which we believe was from the endometriosis being on the ovaries, causing poor quality of the eggs. But once I found out I had low ovarian reserve, I knew that I had to get even more serious about this thing. So that's when I really went all in and making lifestyle changes, permanent diet changes. I started investigating holistic types of interventions like acupuncture that really helped as well, keep the endo away. So for about 5 or 6 years, the symptoms were at bay. And then after that, I started to see, you know, small symptoms trickle back down again. Guys, the journey of endometriosis after pregnancy while going through infertility and trying to get pregnant, getting pregnant, and then after pregnancy is a whole nother story as well. I had a lot of ups and downs with endometriosis during that time, and honestly, I just want to do a whole separate video on that. But what I want to know from you guys is, will you be interested? Will you be interested in a video about endometriosis during infertility and pregnancy and after pregnancy? If so, let me know down below and I will give you just that. And also, if you have any other questions that's related to endometriosis, I would love to know. So ladies, the take home for this video is 1, pay attention to your body. 2, be an advocate for yourself. Be educated and you advocate for what you believe is going on with your body. Let a doctor know, get your diagnosis, and move forward with the treatment as soon as possible. As soon as possible. Not all of us are in a position where we can have children because we have this diagnosis, but at least we can make the necessary changes to our body, our diet, our lifestyle, so that we can decrease the amount of inflammation or complications related to this specific diagnosis. If you know someone that has endometriosis and you have an issue with them complaining about pain or being out of work, please check yourself, because this is one of those diagnoses that seemingly is silent or invisible, I should say. You can't look at somebody and know that they have it, but they may be, you know, missing work or, you know, physically tired, because it makes you physically drained and tired. or, withdrawing or depressed, and you're wondering what is going on with this girl. Well, note that it is very real, it is very serious, you guys, and it is miserable at times. So have some grace, embrace this sister, love on this sister, and educate yourself about what she may be going through, okay? Woo! Thank you so much for being here today. I'm so glad I got to tell you about that part. Hopefully you found it interesting. Hopefully you found it helpful. Please like, subscribe, comment down below so that you can become a part of my community. Ask me questions. If you are a person that needs someone to walk you through changing everything from your lifestyle to your faith base to all the tools that you might need to put in your tool bag as you face infertility or as you try to get pregnant, please email me and I'll put the email right here, or you can DM me on Instagram because I'm very active in Instagram. So join my Instagram family, like and subscribe here, hit the notification bell, all of the things so that we can stay connected. Thank you again for being here. I love you with my whole heart. Mwah.